Hi, and welcome to our Medicare Explained series. We're going to try to help you explain your Medicare options are. So when Medicare was created, FDR was the president that kind of got things going with the Social Security Act in 1935. But basically what he said is we're not going to insure 100% of the population, and of the people we do insure, we're not going to insure 100%. So there's always going to be some cost sharing involved, and it's not for everybody. There's been three significant changes in Medicare. The Modernization Act in 2003 updated the Medicare Advantage and drug programs and introduced those to the system, which are using private insurance companies. And then in 2015, Congress passed the Medicare Access and CHIP Reauthorization Act. They eliminated a couple plans, plans C and F, for 2020. And then in 1983, some of you may have remembered Social Security was going broke. And so to compensate for that, they instituted diagnostic-related groups. And these DRGs are basically a fee schedule that a doctor or hospital agrees to the fee schedule, agrees to the Medicare payment schedule, which is a lot less than what you would get on the regular open market. And so because the hospitals themselves are under pressure to contain costs, they discharge patients quicker and sicker now because of that. So who's eligible for Medicare? You have to be at least 65 years old, or you could be under 65 if you have a qualifying disability that Social Security approves. And you'd be a U.S. citizen or a legal resident that's lived in the U.S. for at least 5 consecutive years. Or there are some special situations, for example, people of any age with end-stage renal disease or ALS. Original Medicare is a traditional fee-for-service program offered directly through federal government. It's sometimes called a fee-for-service. Under Original Medicare, the government pays directly to the healthcare services you receive. You can see any doctor and hospital as long as they accept that Medicare assignment in that fee schedule. You do pay a co-insurance for services you receive. There are limits on how much doctors and hospitals can charge for your care. And they include two parts, A and B, inpatient hospital coverage and outpatient medical coverages. So part A, typically there's not a monthly premium for A. If you've worked 10 years and you've paid your Social Security tax, you have paid for A already. It includes overnight stays in the hospital or inpatient. It also includes skilled nursing and home health care and hospice. Now those last three do require a qualifying event. Of course, hospice is terminal illness. Home health care and skilled nursing have to be approved by a Medicare approved doctor. They have to be in a facility that's a Medicare approved facility. You have to have stayed in the hospital for at least 3 days as an inpatient to qualify for that benefit. And these are a skilled nurse will come to your home, or you're in a rehab hospital, and they will help you with physical therapy, occupational therapy, or speech therapy. So what does it actually cover? Well, as you can see by this chart, the costs have changed over the years. So we're going to focus on 2020. In 2020, there is a deductible of $1,408 per benefit period, and each benefit period is 60 days. That means if you go in the hospital for a stay, that starts your 60 days. If you were to go back into the hospital again and during that same 60 days, you don't pay that again. However, if you go into the hospital after that 60 days is expired, even for the same condition that you're in before, you do pay it again. So you could pay it up to 5 times in 1 year. Now, if you're in the hospital consecutively beyond 60 days, day 61, it starts on a per day copay of $352 per day until you reach day 90. And that's up to $10,000 out of your own pocket. If you're in the hospital longer than 90 days, on day 91, it moved to a $704 per day copay until you reach day 150. Now, those 60 days is called your lifetime reserve. Your lifetime reserve, once you've met that, Medicare will no longer pay your hospitalization. Now, Medicare is kind of an older model. Most of the time you're not going to be in the hospital that long. You'd have to have some kind of disease, illness, or in a coma really to be in that long. And nowadays they're going to move you to a skilled nursing facility instead of keeping you in the hospital that long. Medicare covers the first 20 days of skilled nursing as zero copay, but after that, days 21 through 100, you pay a $176 per day copay, which is up to $14,000. Now, Medicare Part B, there usually is a monthly premium of $144.60 in 2020 that you do pay monthly. It covers outpatient services like doctor visits, specialists, outpatient surgery, ambulance, ER, urgent care labs, and radiology. Now, if you, as you can see, it is also higher based income. So if you have a higher based income, you can pay a higher premium. Here's a chart that kind of shows that. So if you fall within those income requirements, then you will pay a higher premium. And you can see on the far right corner columns the Part B premium, and you also pay an additional Part D premium, which is prescription drugs. Now, it should be noted that they do look back 2 years. So they're going to look back, if you're in 2020 and you become eligible for Medicare, they're going to look back at your 2018 income tax returns and verify what your income was to verify what your premium will be in addition to that. If you fall underneath those limits, you stay at the $144.60. However, if you're higher than that, then you can be charged a higher. What does the Part B cover? Well, in 2020, there is a one-time annual deductible of $198. So that means before Medicare pays it all, you have to pay $198 for any of those Part B services. And you pay it for once for any one of them, and you don't pay it again. And then once you've paid your deductible, Medicare will pay 80% of the claim, and you are responsible for 20%. And as you can see, in 2017, over 1 billion claims have been submitted and 99.3% were accepted. Now, all Medicare covered expenses, a doctor or healthcare provider may agree to accept a Medicare assignment. This means the patient will not be required to pay any expenses in excess of Medicare's approved charges, and the patient only pays the 20% of the approved charge by Medicare. Now, if you go to a physician that does not accept a Medicare assignment, you are limited to the amount that they can charge for that covered service. So most physicians' services can charge above Medicare is 115%. So that means if you go in and you have a service and Medicare says that service should cost $100, but your doctor wants to charge you $120 because he does not accept the Medicare assignment, the most that he can charge you is 115%. So of the $100, Medicare would cover $80. You would pay a 20%, so $20, and then that $15 from 100 to 115, you would pay additional. So now you're up to $35. 115 to 120, the doctor can't bill you that. So that's above the limit of what they can charge. So as you can see that there's been some financial exposure there. Medicare doesn't have any stopgaps. You could keep paying and paying and paying. So what are your options to help cover some of those gaps that Medicare doesn't cover? The first option is on the left, and it's the most traditional option. It's been around since 1965 when Medicare was created, and they're called Medicare supplements. But since everybody tends to call all these plans Medicare supplements, we're going to refer to these as Medigap plans because they cover the gaps that aren't covered by Medicare. And you get they will only cover things that are covered by Medicare. One of the things not covered by Medicare is a prescription drug coverage. So you need that in addition to your Medicare supplement. So Medicare supplements, there's 11 different plans to choose from, but the most common ones are the ones in the middle there, F and G. F is no longer sold to new recipients of Medicare starting in January 1st, 2020. That means if you turn 65 in the year 2020, F is no longer available to you. If you got Medicare prior to 2020, F is still available for you, and you could get into it. The only difference between F and G is one, it's the Part B deductible. That's the $198 that they do not cover. So F is most popular because it covers everything at 100%, as you can see by this chart here. So that means no deductibles, no coinsurance, no Part B deductible, no 20%, everything is covered. There's no networks of doctors. You can go to any doctor that accepts a Medicare assignment. G, like I said, the only difference is that it does not cover that $198, which is basically a one doctor visit. So once you've met that, everything else would be 100% covered. Now, in addition to Medigap plans, you do need a prescription drug plan to go with that to get your drugs covered, or you can face a penalty. So if you don't enroll into a drug plan when you first are initially eligible for Medicare, you can face a penalty. So it's important that you do enroll, even if you're not taking any drugs, to avoid that penalty. These Part D plans are, cover your prescription drugs. They usually have a premium, they usually have a deductible, co-payments, and a drug tier. A drug tier, there's usually 5 or 6 tiers. Tiers 1 and 2 are usually generics. There is a coverage gap as well, which we'll talk about. There's formularies and pharmacy networks. So depending on what pharmacy you go to, may determine what prescription drug plan is best suited for you. Coverage is not automatically, and like I said, penalties may apply if you enroll late. Coverage gap. Okay, how does it work? So when you are first eligible, or when you're first to come on for the calendar year, or whenever you're eligible for Medicare, your first payment is the deductible. Stage 1 is deductible. In 2020, the most that you can be charged for a deductible is $435. Now, some plans could have no deductible, some plans could have less than that, some plans could have that deductible only on brand name drugs. Whatever it is, you do need to hit that first, unless they don't have it. Then you move to stage 2, which is the initial coverage phase. And during that phase, you pay typically 25% of the cost, and that's usually in the form of a copay or a percentage. Now, stage 3 is the coverage gap or donut hole. So how do you get there? When you go to the pharmacy to get your prescription drugs, the insurance company buys that drug from that pharmacy. And when let's just say that's $100, okay? And then you pay your copay. So let's just say it's $5. So that combined is $105. That's called your TROOP, or your true out-of-pocket prescription expense. When that total is $4,020 for all your drugs that you've purchased throughout the calendar year, if it reaches $4,020, you go into the coverage gap, or sometimes referred to as the donut hole. Now, while you're in the coverage gap, the insurance company no longer pays anything for your drugs, but you get a manufacturer discount of 70%, and then you pay 75%, you pay 25% of generics and 25% of the brand name cost. But that is at a manufacturer discount of 70%. Now, if your drug costs reach $6,350 for the annual year, then you go into stage 4, which is catastrophic phase, at which point Medicare now pays 80% of your costs. The plan pays 15%, and you pay 5%, or you may pay $3.60 for generics, or $8.95 for all other drugs. It just depends which one is greater. On January 1st, that's when the plan reset. Now, Medicare Advantage is option 2, and those are sometimes called Part C. They're an all-in-one comprehensive plan provided by private insurance companies that combine all parts of Medicare into one plan. And so they're referred to as Part C. They generally are HMO or PPO network-based plans to help reduce the cost. So you have your hospital stay, your Part A, your inpatient, and your skilled nursing, plus you have your Part B, doctor visits, primary, specialists, preventative care, lab tests. But you can also have additional benefits, most notably prescription drugs. It's not covered by Medicare. And so you have one card that controls your hospital, your doctor visits, and your drugs. And then they can offer additional benefits like maybe dental, maybe vision, maybe hearing, gym memberships, transportation, chiropractic care, acupuncture, naturopath, a long list of different benefits that they can provide. Now, these are network-based plans like HMOs and PPOs, so you have to realize that if your doctor is in one of those networks, how that might have ramifications on your care. So which one's the best option for you? Well, that determines on what kind of utilization you are with your health care and what types of prescription drugs you might have, but you could do either one. Typically, for somebody that's 65 coming on to a Medicare supplement plan for the first time, those factors are based on your age, your gender, your tobacco use, and your zip code. But typically, you can be expected somewhere around $130 a month. That's in addition to the $144.60 that you're paying for Medicare. And then you do have to buy a standalone prescription drug plan. And that can be anywhere from $15 a month on up to $60. So it just depends on what your needs are on your prescriptions. Medicare Advantage plans, these network-based plans offered by private insurance companies, can range anywhere from $200 a month all the way down to $0. So there are plenty of zero premium based plans that are in the area that you can take a look at. And you may ask yourself, how can they offer a zero premium plan? Well, these companies bid on a plan area and say, this is how much we expect the plan to be able to fund it. And Medicare will put out a bid. And if they come in beneath that bid, then they can use that money that they saved on that bid towards premium, and they can reduce the premium that way and add additional benefits. Now, how do you fill some of the gaps in Medicare? These Medicare Advantage plans will have co-pays, co-insurance, and annual out-of-pocket maximums that are required by Medicare, but they won't cover everything, just like the Medigap plans in most instances won't cover everything either, because some things aren't covered by Medicare, like custodial care or hospital indemnities, cancer, heart attack, stroke. These are all plans that can help you cover certain scenarios where Medicare doesn't cover: dental, vision, and even final expense. So if you have any questions, reach out to us. Go to www.senioradvo.com. Look for advocate listings and contact information there. Thank you for joining us, and we look forward to hearing from you.